Clark, and I've been a hypnotherapist for the last 8 to 9 years, and I've been a holistic therapist for the last 14 years. So I'm talking about different topics, what we find in hypnotherapy and so forth. So we'll talk about a subject pretty controversial in some respects, but it's actually about major mental health conditions and their differences. So there's a lot of people believe that mental health can be cured by many different things. There should be more mental health clinics to help the people and so forth. But I'm going to explain a few of the differences between mental health and what these issues are. And whether as a hypnotherapist or a CBT therapist or a psychotherapist, whether we can help. And unfortunately, there's a lot of bad news on this, actually, is that we can't help certain types of mental health because it's actually for a psychiatrist or a professional medical person. So I'm going to explain the first one, which is quite common in a lot of people, is bipolar disorder. And this involves distinct episodes of depression and hypomania or mania. And during these depressive episodes, people experience very low moods and a loss of interest and fatigue. And during these manic episodes, they may have elevated mood, decreased need for sleep, racing thoughts, and impulsive behaviour. So they used to call this actual condition manic depression. Now it's called bipolar. The reason bipolar is because it's two, being bi, meaning very different types of moods. So this differs from conditions like major depression, which involves persistent low moods without manic episodes. Schizophrenia, which primarily involves psychosis, delusions, and disrupted thinking. Also with schizophrenics, if they are involved in alcoholism and drugs, it makes them even worse. And anxiety disorders, which some people do think they have an anxiety disorder. It's actually they've just got general anxiety, but anxiety disorder, which centers on excessive worrying and fear responses. So the alternative therapies and complementary approaches, while these should never ever replace prescribed medical treatments for severe conditions, some evidence-supported complementary therapies and approaches can help. So I'm going to give you a few approaches what can help people with these type of conditions. So mindfulness, meditation and yoga for anxiety and depression symptoms. So mindfulness is the other word, is breathwork, pranayama. So using breathwork, visualization and so forth, and general yoga, which also exercises, clears the energy of the body and helps with that. Regular exercise could also help stabilize the mind. So people who have anxiety, if they actually increase their mood, dopamine level increases their mood. So that really is useful. Sleep hygiene practices. So improving your sleep hygiene, making sure you get regular sleep patterns, and within that you don't get distracted. That also can mean that you're away from electronics when you're going to sleep and so forth. Nutrition therapy and omega-3 supplements. Omega-3 helps with the brain functionality, which actually helps reduce the anxiety of the brain. Now, obviously, with nutritional therapy, the better food you eat nutritionally actually helps the body flow better, which allows to not be having such an elevated mood. But because what you want is you want the mood to be elevated but positive, not that it's over manic. So it's kind of getting that balance right. And peer support groups. So what is the restriction alternative practitioners? Well, when you're dealing with mental health, you have to know a few things. So alternative practitioners, when we're saying this, are hypnotherapists and some counsellors typically cannot work with severe mental illnesses. And these are the reasons because. So number one, safety concerns. The lack of medical training to handle crises or emergencies. You just are not trained to do it. You're unable to prescribe or adjust medications because you are not a trained doctor. You are not a trained pharmacist. You are not a trained professional in that way. When we are hypnotherapists or psychotherapists, we are there designed to help with the mindset, but we're not there as so even if we say nutritional, we can give nutritional advice, but we're not a nutritionist. There's a different type of category. So if you're a nutritionist or a doctor, you train for 3, 4, 5 years, then you're in a practice, and so you have about 5, 6 years training before you even can work on a person. You also may not recognize warning signs of psychiatric emergency. So some people's psychosis, as a hypnotherapist, you may not recognize or understand. So you're literally putting yourself in a situation of danger. And then the limited ability to coordinate with medical professionals. So even as a hypnotherapist, we do always ask on the consultation or the discovery call for a doctor, but that doesn't mean we always get them things. So a lot of the time we do not discuss medical issues with the doctor. We hope the client is honest with us and that we get them information. Now, this is the other thing as well. In the consultation, we find out whether we can work with people. Now, I spoke about this the other day about narcissists, psychopaths and sociopaths. And with mental health conditions, it's the same thing. So the consultation is so important because it's actually whether you know you can actually help the person. So number 2 is your scope of practice. So these practitioners are typically trained for mild to moderate issues. So a hypnotherapist is always about how do we get better mindset? How do we help people in their relationships? These are in consideration to major psychosis and psychiatric issues. We are not trained to deal with the people who go to mental facilities and so forth. We're just not trained for it. So we can only help people so much. And the thing is, actually, we should also be professional enough that we make sure that whoever the family is, I think it's worked with the family so we know if they have reached out to us, that we contact the family and say this person's reached out to us, maybe they need to be checked on and so forth. Severe conditions, they require specialist and specialized medical oversight. Again, we're not medical doctors. We're just not. Hypnotherapists, therapists are not medical doctors. There is a difference. We know this. So when people say, oh, I can help you cure this, they can only help cure in certain ways. You cannot help people on the medical front. And people have got to be very careful when you're doing this because you actually are up for liability if you're not careful. The risk of inadvertently triggering or worsening symptoms. Triggering or worsening symptoms can happen, especially if you're dealing with bipolar people, because you could have the client, say, for example, you pass them, you work with them one day, you work with them, one session, and the next session, are a completely different person and they've forgotten what you've done. And because their mind is like a split personality, it's incredibly difficult. And you have to be very wary and you have to look for telltale signs of people. So, and then the legal and ethical obligations to refer to appropriate medical care. We can help and give people advice to say, right, go to medical care. There are certain things we cannot do. We just cannot do. And we have to understand that. And I think this is something where some people go, oh, it's got psychosis and stuff. And they say they want to go to a hypnotherapist or a therapist or psychiatrist or counsellor. There's just certain things they just cannot do. And if people are very severe, they do have to go to a medical professional. So the clinical complexity, and this is where severe conditions are required integrated treatment approaches. So this is about how they are, usually sometimes these people, if they've got really bad issues, they have to have a carer or they have to be working within a facility. Symptoms may interfere with therapy engagement. So again, with therapy engagement, it can cause a lot of issues. So you have to be wary of that. And the higher risk of self-harm or crisis solutions. And this is the thing you could actually bring up, if you're a hypnotherapist, you could bring up some trauma, help with it, but you could actually bring up some other trauma. And that would then cause the problem of the person could do all sorts of things. And the need for careful medical management. Again, medication management is not a hypnotherapist's job. It is not a psychotherapist's job. It is not a counsellor's job. That is a medical professional's job. So this is why I'm saying this, is because I think people seem to think that hypnotherapists can do wonders in a lot of things, but there's certain things we just cannot do. So for severe medical health conditions, treatment should be overseen by psychiatrists and clinical psychologists. Being a psychologist and being a clinical psychologist are two different things. So, and the thing is, these people who have very advanced medical training, they know about crisis management capabilities. They have the ability to prescribe and monitor medications. They know about hospital admission privileges if needed, and their regular supervision and support systems. So if any of you believe have mental health issues, if you do suffer with either bipolar, schizophrenia, and so forth, that is something I cannot do. However, we can work with people with depression and we can work with people with anxiety. But with major depression, if we see that the person in the consultation has a major depression issue, we would not work with them. And I think this is something we all have to understand, that we cannot always help everyone. And it's not to be negative, but I think what I'm trying to explain is, as a therapist, there are certain things within the restrictions we have. However, if you do feel that you are having issues which are leading towards major depression or anxiety, please do not hesitate to call me or contact me via after this video on the platforms I share this video on, or I can maybe actually find out and get some help with your family to actually help you with some medical or psychiatric and put you in the right place. Again, I would not be taken involved in doing that, but I will actually put you to the right people to help you with that. Anyway, until next time, speak to you soon.